And let's turn now to family physician and associate professor at Rowan University, Dr. Jen Caudle. Dr. Caudle, welcome back to the show.
Thank you. Good to see you.
Always great to see you. So, Dr. Caudle, you noticed this mole and went to get it checked. Is that how skin cancer is most often diagnosed, at least in JD's case? We heard his story here.
Sure. So, skin cancer is diagnosed in many different ways. Sometimes people see something themselves. Sometimes a partner or a loved one notices something. Sometimes it's a routine skin check, or even as a family doctor, every now and then I find something and I have the patient get it biopsied and it is skin cancer. So it's many different ways that we find these. The most important thing that JD says is that we do find them. And I just want to say hats off to JD. As you mentioned, we're so glad that he is cancer free, and also that he did listen to the nagging voice in his head to go get checked, and that he's spreading awareness. This is very important.
I'm so glad you said that, especially as a physician. Listen to that nagging voice. So, Dr. Caudle, how can people ensure they're staying safe in the sun?
Yeah, we're coming up on that time of year where being in the sun is what a lot of us are going to want to do. But there are different things that we need to be careful about and be vigilant about. Of course, avoiding UV radiation is the most important thing. That's the sun. Avoid being out in the direct sunlight. And if you are, you need to be wearing sunblock. JD mentioned 15 SPF. The American Academy of Dermatology recommends 30 SPF. Make sure that your sunscreen is broad spectrum and that it's also water resistant. That's super important. We need to reapply every 2 hours or so we can't just put it on and leave it there forever. But the other things too is, in addition to wearing sunblock, is making sure that, again, we're avoiding the sun at the hottest times of day. That's 10 a.m. to 2 p.m. Making sure that we're wearing light colored clothing, that we're wearing hats, that we're staying hydrated. Don't tan, by the way. Tanning is not okay because that's UV radiation as well. And then, of course, getting our skin checks, very, very important there.
Dr. Caudle, there are so many myths out there. I know me being brown, to be honest, when I was growing up, I didn't put on much SPF. I thought I was okay. Mm-hmm. As I'm older, I know that was a mistake. So how often should everyone be getting checked? And does it differ based on skin tone or hereditary factors here?
I'm so glad that you talked about being brown. As a brown woman myself, I grew up with the myth that Black people don't get skin cancer, or black people don't need sunscreen. That is a myth. And I'm really glad that you brought that up, because honestly, people of all skin colors can get skin cancer. And we all need to be wearing sunblock and stay out of the sun, no matter what color we are. So really important point to bring up. Skin cancer is the most common cancer in the United States. I think a lot of people don't know that. And 1 in 5 Americans will get skin cancer. So, it goes back to this idea that no matter what color or shade that we are, we need to be using sun safety properly. And Hannah, you mentioned getting checked for our skin. Honestly, how often we get checked depends on our hereditary factors, our personal factors, any medical conditions that we might have had. JD mentioned that he was going pretty frequently now that he had been diagnosed and treated for melanoma. Other people may not have to go as frequently. The biggest thing is to talk with your doctor and see how often you should be checked.
Such great information. Dr. Caudle, thank you, as always, for being on the show.
Thank you.